that's okay with you? And away you go.
Yeah, I had to unmute myself. There we go. So first of all, when you're talking about your meeting, are any of your group members or belong to the IAOMT?
I don't
Or
know
heard
if
about it?
I haven't. So
It's the International Academy of Oral and Medical Toxicology. There are probably more dentists than anything else, but we do have quite a number of MDs and PhDs, the research guys doing the research on mercury and fluoride and that type of thing. Dr. Mercola is coming to our meeting here the 1st of March, 3rd and 4th of March, and so we're excited to hear him and several others. It's usually a really good meeting. So that's something that any of you could join, and there's also the IABDM, the National Academy of, I don't remember exactly what it is, but it's a similar group, and we join the meetings usually at least once a year. That group tends to have more physicians and less dentists, but whenever we join it, we have better meetings. So just a plug for that. First of all, I don't know how much information or experience all your group has with biological dentistry. Some of you may know a lot, and some of you may know very little. It's a niche of dentistry. There's not a lot of us. We're hoping to grow that. We're always trying to teach new doctors. We provide a scholarship program to dental students that are in dental school to come to this meeting. And so there's, sometimes we'll have 6 or 8 or 10 students that come to this meeting. So we're starting to grow our ranks. I think we're up to about 1,300 now around the world. So anyway, that's a great meeting. There's a lot of information on this site for patients or professionals, and anything you want to look up about mercury or fluoride or anything like that, you can usually find it on this website and has some great information to show your patients. Let me put my PowerPoint here. Go back to the beginning. I can never remember how to turn this onto the main screen.
yeah, that's it. Go there, go to the beginning, right here.
And from the beginning, there we go. That'll help. We'll give you just a quick rundown on what biological dentistry is and kind of what we think, and then I want to leave plenty of time for questions or comments or concerns. This is just the alternative approach to dentistry, so it's like what you guys do, but for dentistry. We know that the oral health is connected to your overall health. Many of you have probably seen this tooth organ chart. Let's see, that one doesn't look very good. Let me see if I can pull up another one here that you can see better. Somewhere I've got it. Thought I had it up. Where'd it go? All right, this one should be a little more clear. So hopefully you have all seen this before. If you haven't, this is looking at Chinese medicine. This is the connection between all the different body parts and the teeth. So a lot of my patients come to me from a naturopathic doctor, DO, chiropractors, who say this patient has a liver issue or this patient has got a heart issue, and look specifically at these teeth that are attached to that. So you can see the connection between all the teeth. Many of you have probably heard of the Paracelsus Clinic in Switzerland. They went back a while back and looked at about 20 years of their patients, and 98% of their breast cancer patients had a root canal on the tooth associated to breast on the same side as the initial tumor. So there seems to be a pretty good connection there. And we've seen that over and over in our clinic. So that's one of the things that we'll talk about, or the connection with root canals. Let's do that again. For most dentists are familiar with the connection with gum disease and heart disease. And that's something that about any traditional dentist will talk about and tell you. One thing that we've discovered is if we can really boost their D3, then most people's gum disease will go away without having to have all the deep cleanings and all of the, years of slowly losing bone around your teeth and the connections to the heart disease. So it's a simple thing, but if we can get their D3 way up, then we see great results. We like to have them over 60,000 on their D3 before we do surgery. And then we don't have failures with implants, or the people heal well. And we've all seen some of the research with the COVID that it's the people that are low on D3 are the ones that get sick with COVID. So there's some information about that. You guys probably know more about that than I do. There are a couple of books that you can find out more about the root canal connection. Dr. Weston Price years ago went back and isolated, this is a really abbreviated version of what he did, but he isolated the bacteria from root canal teeth and injected them into rabbits. And whatever the patient had that had that root canal, heart disease or whatever, most of the rabbits got that, but some of them got something else, but they all got sick. And so he finally isolated it down to the bacteria that are in these root canal teeth. Let me jump out here and show you while we're talking about that. This is a connection or a test. A lot of times when we extract a root canal teeth or clean out cavitation areas, we will send a sample into this DNA connections lab and say, what's in this? And I'll blow this up a little so you can see it. But this is a root canal tooth we took out recently on a lady, and there's 27 different strains of bacteria in there. You can see that most of them are in the red. That's quite a load on the immune system from one tooth. If that tooth is on, for example, the stomach or breast meridian, then a lot of times we will see a decrease in the body's ability to fight back of whatever their issue is, because it's fighting such a battle in this area with the bacteria. These bacteria like to get out into the system and land. Heart's the big place. Every new patient we have gets this book by Dr. Levy, a cardiologist. He's actually lecturing at our meeting in a few weeks also, called Hidden Epidemic. If you haven't seen this or read this, this is one you need to get. He talks about how these hidden oral infections cause most heart attacks and breast cancers, and goes through, for one thing, the necessity of getting a cone beam 3D x-ray. We take these on every patient. I have patients mail them or email them to me from all over the world to read their x-rays, because their dentist or their biological dentist in many cases tell them that they're fine, they don't have any problems, and we find infections around root canals or cavitations, which is one of the biggest things. So
and just to interject, Dr. Levy will be at our conference.
Oh, great.
He's on Saturday afternoon.
He's fun to listen to. He does a great lecture. One of the big things that he covers in this book are the root canals, and then he goes into we think pretty much all root canals are bad. Now, we have to be a little bit careful about what we say, but that's kind of going away. There's also, so here, this Toxic Tooth is another great book. Root Canal Cover-Up. Dr. Minig was the head of the Endodontic Association, spent his whole career teaching root canals to dentists on weekends. And about the time he went to recover, he found Weston Price's work and looked into all the data that's out there and showed, wow, I've been killing people my whole career, or at least not doing them any good. And so he wrote this book, Root Canal Cover-Up, and that's a great one. The Price Pottinger Foundation has access to a lot of this work as well. We'll go. So what do you do about a tooth that needs a root canal or has a root canal? The alternatives are, number one for us, is extraction. We recommend to every patient they remove their root canal teeth. Many times since we've started using the 3D x-rays, we see a hidden infection behind the root or somewhere that's been there for years and years, and many times there's no pain. That's why Dr. Levy called his book Hidden Epidemic. Many times there's no signs or symptoms, no pain, tooth feels fine, but it's got this great big infection. I'll go through a little bit here later on, a CT scan of a case I just did today, and show you what kind of things we see on people that oftentimes have no symptoms, except their autoimmune disorder or their cancer or that sort of thing. What we used to replace the root canals used to just be titanium implants. Now we're really turning the corner and saying, let's stay away from any metal in the mouth. So if it's dead, like a root canal tooth, or it's metal, so anything metal or dead doesn't belong in your head. Any metal fillings. One that most people don't think of are porcelain fused to metal crowns. So you look in your mouth and you see a white tooth, you think you have a porcelain crown, but underneath that is a hidden layer of metal. And underneath that metal, oftentimes, is a mercury filling. Well, those different metals, a lot of times have a lot of nickel in them as well, but those different metals connecting with each other creates a galvanic reaction that's kind of like walking around with your tongue on a 9-volt battery all the time. And you can actually measure a lot of these with a voltmeter, just from Radio Shack or wherever. And so that's always interesting. People are just walking around electrifying their heads. One thing that we've discovered recently is these titanium implants make a really good antenna for your cell phone, but they're not very good for you. And the clinic that I've been going to for training in Switzerland, Dr. Bowles and Dr. Klinghardt, they're showing that the bone around these titanium implants heat up about 5 degrees Celsius when you're on your phone. So you literally cook the bone around these old titanium implants. And we're starting to see about 10 million titanium implants fail in patients' mouths right now. And the dentists are just at a loss as to why they're losing all these implants after sometimes 15, 20 years. So all of the Wi-Fi signals, the 4G, 5G, all these different things that we're doing to ourselves now are having a huge effect. One study done in Iran several years ago, they took a bunch of young women and they gave them all several mercury fillings. And then they gave them a cell phone and they tracked how much mercury came off these mercury fillings, because they're always off gassing mercury. They never stop. And it was about 80 times more mercury release. Now that was done before 4G and 5G towers. So you can imagine what they're at now. Bridges you can always use to replace these extracted teeth or partial dentures, but most of the time we're doing these ceramic zirconia implants. It's a totally neutral material. It doesn't block the meridian. The body has no response to it. The tissue loves it. The gums are always really healthy around it. And in our clinic, about 95% of the time, the same day we take the tooth out, we put the ceramic implant in. We let it heal for 4 or 5 months and put the crown on it, and you've got a new tooth. It's important when we clean out these extraction areas that they be done with some protocols. What we do when we extract a tooth is we'll use an ultrasonic, a piezo ultrasonic instrument, and we'll diamond tips on it, and we clean all of the ligaments that attach the tooth to the bone. If you leave those ligaments behind, the body thinks that something might still be there and it doesn't fill in the space with the bone as good as it does if you take the ligaments out. And they're kind of like trampoline springs. Teeth have a little bit of give to them. So when you bite down on something hard, you're clenching your teeth in your sleep at night, the teeth all have a little bit of give. And so those ligaments that attach the teeth to the bone have to be removed when the tooth is extracted. After the ultrasonic, then we use a laser. And so we use erbium YAG laser, and it's a technique that actually was designed for root canals. And so using this root canal setting, it kind of looks like boiling water, and it makes little bubbles in the solution, and then the laser pops the bubble with the next pulse, and then that cavitation effect of the popping bubbles shakes all of the junk out of the corners and the areas that we might have not gotten mechanically. And so using the laser has been one of the biggest game changers for us. Then we go in with ozone. We do high concentration ozone, and then we'll use platelet-rich fibrin. All platelet-rich fibrin is not the same, and many doctors are still using PRP, platelet-rich protein, or plasma-rich protein. PRF is many, many, many times more effective. A lot more stem cells, a lot more growth factors. It's something that, if you're familiar with some of these older techniques with the PRF or the PRFG, these newer versions of the platelet-rich fibrin are far more effective. It cuts pain and inflammation and swelling by 70 to 80%. I have patients that I take out 7 or 8 root canal teeth, put in implants, clean out wisdom tooth pockets, and they don't even take Tylenol after surgery. Those are usually 8 to 10 hour surgeries, and people don't even, many of them don't even take ibuprofen and Tylenol. The ones that do need something only take ibuprofen and Tylenol, and it's rare that they need like a narcotic. If you're going to have a root canal done, there is some good research. We have a biological dentist who's a root canal specialist in Beverly Hills, Val Cantor, teaches at USC. She's done a lot of work with this laser and showing that she thinks some root canals can be done clean enough that they're not making people sick. I think the jury's still out on that a little bit, but if you're going to save a tooth, at least have the root canal done with a laser and ozone. And then there's a new gentle wave that's a rinsing technique, and then it has to be filled with bioceramic cement. So there's a protocol that should happen, and those root canals do much better than the old traditional ones that most dentists are still doing. Now, cavitation, this is my favorite one. This was the main thing I wanted to talk to you guys about. A lot of doctors don't even know what cavitations are. It's focal osteonecrosis. They're areas of dead bone. So wherever these teeth have been extracted, these old root canal teeth, if they weren't cleaned out properly and all this bacteria cleaned out, then many times they will leave a dead spot in the bone. Which for most of us, the teeth we've had extracted are wisdom teeth. Because of the shrinking of our jaws, because of our softer diets and sugars and the things that Weston Price showed us years ago, most of us have to have our wisdom teeth out. But if they're not taken out using those techniques, then in the cadaver studies that they've done, looking at several thousand cadavers, there's 85 or 90% of them have cavitations. Now with the cell phone signals and the things that we're seeing, and nutrition being so poor in so many of these late teens, early 20s kids, I think it's higher than that. And at the clinic in Switzerland, they just automatically clean out all 4. If you've ever had a wisdom tooth taken out, you're going to get a cavitation surgery. And that's kind of Dr. Klinghart's way. The way we find these cavitations are the cone beam x-ray. I always double check them with kinesiology as well and back up. And it's nice to show the patients using muscle testing, just have them put a finger right on that wisdom tooth area and then muscle test them. And you'll see what happens. Same thing with a root canal tooth or a mercury filling. If you want just a really good explanation of what's happening to their meridian system, then that's something that we do with a lot of our new patients. These cavitation sites have a huge correlation to Lyme disease. A lot of them, Lyme and mold and these type of things. A lot of the mercury traps in these areas as well. It's kind of like a dead end, like an eddy in the current of the stream. If you think of the waterfall and back in the corners where all the sticks build up, that seems to be what happens in these wisdom tooth areas. There's huge link to cancer. The scientific name is FDOJ. That's osteonecrosis of the jaw, fatty degenerative osteonecrosis of the jawbone, or osteolysis of the jawbone. There's a huge degeneration of the adipocytes, but you don't see the typical leukocytes. You don't see a lot of white blood cells. So patients will say, how can I have these infections in my mouth? I just had my blood work done, and I don't show anything on my blood work. But we go in and do these DNA tests and show all these bacteria in the area. They have very poor circulation. This can't get out into the system as well, which in some cases is good. There's super high levels of this pro-inflammatory anti-CCL5, and we're going to talk more about that in a second too. That's a great one. There's an absence of acute cytokines, so we don't see, like you would expect with an infection, just inflammation in the acute cytokines. That's why we think they're painless and why they hide out for so long. The average, this Rantes protein, CCL5, a couple of years ago, we looked up how many papers had been written on this, just looked up on Google Scholar, and there have been over 60,000 papers at that point have been written on this Rantes CCL5. The normal level in jawbone's 150. In these cavitation sites, we typically see it over 5,000, and in quite a few of the breast cancer patients, we see it over 7,000. So it's just huge expression. These are in these papers on Google Scholar with this Rantes. They've connected it to just about everything, about every cancer, rheumatoid arthritis, the MS, Parkinson's, allergies, food allergies, all kinds of things. And so it seems to be kind of like the blinking red light that wherever it gets out into the system and lands is where the patient will end up having issues. Dr. Levy talks about the link to tonsils and all these chronic infections in the head draining down into the tonsils and seeing chronically infected tonsils. C-reactive proteins elevated, bacterial infections in way distant sites, and not just the heart. But when you do pathology reports, when they change like the stents in coronary arteries and do pathology on them, many times they'll show oral bacteria is the main source of the bacteria that are filling up the stents. How we fix the cavitations is the same way I just explained cleaning out an extracted tooth. We open them up with the ultrasonic, we laser, ozone. I use a high dose of multiple homeopathics. We do the PRF, we do procaine on every site. We put them on a detox protocol and have them take a bunch of supplements and really boost their D3. Going back to the tooth organ chart, the cavitation, the wisdom teeth site are all on the heart meridian. Let's jump back to that really quick because that's a good one to see. Get this bar up here in my way and I can't see my stuff. So if you look at the wisdom teeth, the 1, 32, 16, 17, besides being on the heart meridian, blow this up a little bit so you can see it. They're also on inner ear. So a lot of the ringing in the ears and the imbalances and Meniere's and things like that. Shoulder and elbow. I've had half a dozen patients that had like a frozen shoulder, couldn't lift their arm up, past here. And we'll take some procaine and we'll inject it over the cavitation site on that area. And for 3 or 4 days, and usually within 5 minutes, they've got full range of motion. After 3 or 4 days, the procaine wears off and it goes back to normal. But that's just a sign to show the patient this cavitation may be one of the things that's affecting your shoulder. I've seen knees and ankles and all kinds of things that we clean these infections out of the mouth and their other pains go away. So that's interesting. The central nervous system psyche is on this meridian. And so sense of well-being, a lot of the anxiety and depression and those type of things. We've seen a lot of patients that see huge improvements after cleaning these out. Energy metabolism, the chronic fatigue, fibromyalgia type stuff, peripheral nerve pain. Again, that feet and hands and shoulder and elbow. And each tooth has its meridian that's attached to things. The molars are usually the ones that have the root canals most often. So we usually will see digestive issues. We'll see, irritable bowel symptoms, and a lot of cancer. We just had a patient recently that was told she was terminal. There's nothing they could do for her. She's doing hyperthermia. She's doing several other things, but we took out all of her root canals, cleaned out her cavitations, and 6 weeks later, she came back and said, guess what? My tumors are gone. So we've had quite a few of those that once you get the interferences out of the way and give the immune system a chance to turn back on, then the body knows what to do and it fixes whatever else is going on. This is an example of a picture of this cavitation oil. Let me see, I've got it on another one we can blow up here. This is during surgery. We open up the wisdom tooth area. It starts bleeding and we hit it with the ultrasonic and these huge drops of oil come out of the jawbone. It looks like butter that's been in the microwave is how I could best explain it. So this just degeneration of the adipocytes in the jaw is just full of oil in these areas. When we look on the x-ray, they just look like really soft bone. And so having the software to read the cone beam and read the bone densities is really critical to finding these. And that's why we find so many more than many of the other biological dentists. If they don't have the right cone beam system, they're just kind of guessing and they can't really read bone densities, which is to date our best way of finding these. This is a picture of the cavitation. Let me go back to, got a better one of that too. It's hard to see them on these slides sometimes. So this is a lower jawbone in a cadaver. This is the wisdom tooth area. And you can see the big spaces in there. All these spaces are full of this oil. When we open them up, it looks like jello, or it looks like some just really soft, just adipose tissue. It just looks like fat. And then as soon as we hit it with the ultrasonic, it just turns into that oil that we were just showing you. This is the mandibular nerve down here. All this bacteria draining down through the jaw eats away the myelin sheath on the nerve. And some of these patients will have like trigeminal neuralgia, or they'll have these crazy face pains that no one can diagnose. And many times it's because they got bare wires on the nerve because this myelin sheath has been disintegrated. The downside to that is when we do surgery and we're doing laser and ozone and all these things in here, that occasionally that nerve will be damaged and the patient will have a little bit of numbness in their lip that lasts usually a few weeks. Occasionally it'll last a couple of months. It is possible that it'll be permanent and they won't get all the feeling back in their lip, but we haven't seen that yet, luckily. So that's a good example of what we're looking for these cavitation sites. Here's another picture, bunch of little shots of a surgery, little open window back here where we have opened up that cavitation site. As it comes out, you can see the shiny with the light. That's all just the oil coming out to the surface, these big drops of oil. Sometimes they smell really bad. We've had them, and those are usually cancer patients, where we open that cavitation site and it stinks up the whole room. It's just rotten. The top window of bone, when we open that little window of bone, we'll usually save that and use that for our pathologies, or we'll take photos and save for our records. This is what it looks like underneath. This is that fatty stuff that's stuck underneath that top layer of bone. Around many of these titanium implants, because titanium doesn't heal completely with real bone regenerating around it, it creates basically an inflammatory reaction in the bone, and it heals with like scar tissue of bone. And because many of these are put in cavitation sites where teeth were extracted, we see huge levels of the cavitation area and this rantease protein, and TNF alpha as well, around these implants, titanium implants. There's a new, there used to be, it's called a cavitat here in the US, that we could find these cavitation sites using ultrasound. It got shut down basically, and one of those things that actually worked, so they shut it down. They've got a new one coming out of Germany, Cavital, that does the same thing. And we hope to have that soon. They've been saying next year for a few years now, but COVID's kind of set that back. Here's what that looks like. It's just ultrasound readings, and wherever there's the red or the orange is where there's soft spots in the bone. So we'll have a way that we can follow up, or that we can verify what we see on the x-rays, or that we can find these even without radiation with the x-ray. Our digital x-rays have much lower radiation than anything we've had in the past, and my machine won all the awards for the lowest radiation, but there is some radiation. We always keep homeopathics, Radnex, and things like that. So if we have a patient that's sensitive to EMFs and radiation, after taking x-rays, we give them homeopathics, and that's something that you guys can do to help prepare your patients. Real quick, we'll hit the big ones you probably already know a lot about. Mercury, dental amalgams. It's the most poisonous, naturally occurring, non-radioactive substance on Earth. It's the only thing worse for humans than mercury is radiation. Last year, for the first time, the FDA recommended that kind of the dentists stop using these in the US. What they recommended was for children, pregnant women, or immune compromised, that they don't use the mercury fillings. There's many other countries have been saying that for a long time, but for the first time, they're starting to say that in the US. They did a big study on the mercury more than 10 years ago. It didn't look good, and so they hid all the data, and it disappeared, and they never published on it, and most dentists never saw the information. But we know it contributes to at least 100 health issues: heart disease, autism, chronic fatigue, MS, all of the things that you guys know. When we take out mercury fillings, there's a protocol that the IOMT teaches called the SMART protocol. They have to be isolated. You need to put them on oxygen, and this is something that you guys might give me some feedback. Dr. Klinghart's saying that when we put them on oxygen, it could open up the blood-brain barrier, so that any vapors that they do possibly inhale through the mouth or whatever, that it might get to the brain easier. And so the protocol is oxygen, but he's kind of arguing with that. And so some dentists are switching to using room air, or hanging a hose out the window and having them just try to breathe outside air when removing mercury fillings. So there's some work being done on that right now. I know several dentists who have had to retire from dentistry because their mercury exposure gets so high that they get tremors and can't work. Shaky dentists are not good. So that's something that many dentists aren't even aware of, protecting themselves. Study in Canada a few years showed that the wrist right above our gloves is where dentists are building up massive mercury and soaking all of this mercury in through their wrist. And so wearing gowns when we take out mercury, we have a big vapor, looks like a big elephant nose, that we use for removing the vapor while we're drilling. And afterwards, there's vitamin C, chlorella, cilantro, vitamin C, zeolite. There's several good things, and we try to get them back to their functional medicine doctor or working with them before they come in. And so they've got a more long-term detox for their mercury than what we give them, because it really can take years to get the mercury out of the system once we've gotten rid of the source. It's not a month detox and you're good, or a few IV chelations and you're good. That just doesn't work, getting mercury out of the brain. Had a patient a while back, had a mouthful of mercury fillings. He had just about every tooth full of mercury. We took them all out, and within a couple of weeks, within a week, his severe IBS for 15 years was gone. That's just one example of many, many. There's a great video on this University of Calgary where they showed how the mercury affects the neurons and things like that. And so that's a really good one to look at. Fluoride, there's a couple of big studies that come out in the last few years, one in Canada and one in Mexico, showing that children that are getting fluoride have a decrease in IQ, and sometimes it's significant. And so giving kids or pregnant women fluoride supplements is a direct decrease in IQ on kids. A couple of really big studies. We know it contributes to bone cancers, dementia, fertility. It makes people really passive. Fluoride is one of the things that Hitler used in the concentration camps to keep the prisoners passive. Heart attacks. It's just, there's nothing good about fluoride. It's the whole, there's some great books about fluoride. So many years and years of misinformation about fluoride that most dentists believe. And when researchers, professors speak out against it, they've been chased out of their universities, they've been shut down. Just what we're seeing now about everything about COVID. So there are some good books about that, but let me see, this Fluoride Gate, what came out, Dr. Kennedy did this a few years ago. Maybe you guys have heard from him in the past. There are some good resources out there, some good books about fluoride. Anyway, Dr. Tennant lectures often at our meetings as well. And he talks about how much most chronic disease begins with an emotional event. And he talks about how trapped emotions in teeth can block the meridian and cause the teeth to start to have issues, which could end up with a dead tooth or a root canal or something. And so we're starting to see that even, you know, some of these things like energy work and energy medicine can have a positive effect on some of these patients where it's blocking the meridians in some way. So it's a good book by Elaine McCusick, Tuning the Human Biofield, talks more about that. But anyway, these are some other things that we've run into. Let me jump out of this one now real quick and get to this other one. If I can find it. But that thing. Now let's do this. Just open it up again. So Dr. Johann Lechner is runs a program in Germany, and over there they have a program where you get your MD and your dental degree at the same time. I think it's a 6-year program, and you come out as a specialist in biological dentistry and medicine, working with all of the things that we've talked about. He's probably done the most research of anyone on this Rantes chemokine. If any of you want this whole set of slides from him, he said I could share them with anybody I wanted. He came a couple of years ago to our IOMT meeting, and a lot of that stuff that we talked about in some of those pictures we've gotten, I got from him. He's in Munich, Germany. A lot more of the science on how this Rantes protein works, and we won't go into all that now. These cavitation sites, a lot of times, will not just stay in that tooth or the wisdom tooth area, but because of the kind of spongy nature of the bone, the medullary bone, it will spread through the jawbone, and sometimes we'll have a lot of the jawbone infected. Now, we can't just go in and do surgery around the roots of all these teeth like we do in the wisdom tooth areas, or we kill all these other teeth and then have a bigger problem. So what we do a lot in my clinic is we use an Nd:YAG laser, and we do biostimulation with a laser that penetrates through the bone and will break up some of the bacteria and stimulate circulation and healing into the area. We've probably done about 500 cases that way, and have had really good luck on some of these areas that we can't do surgery on. He's got some other good pictures and slides of the oil cysts and things like that we talked about. But these are the cytokines. The interleukins and FGF2 are also really high in these cavitation sites, but obviously that Rantes protein is the bad guy. And my mouse just stopped working. Sorry guys, just lost my mouse for some reason. Good time for questions. That was pretty much what I had. I think covers the majority of it. I do want to show you a cone beam x-ray and how we look at those. If I can get a mouse working.
Okay, in the meantime, if anybody has any questions, comments, you can either put it in the chat or ask Dr. Chandler.
Oh, I see there's some in the chat. I can't get to it.
If
See if I can grab another mouse here real quick. Got an old school plug-in mouse we can throw on here.
okay, a question from Dr. Southard. What are your thoughts on oil pulling?
It can be really effective for gum health when you've got the inflammation in the gums, periodontal disease. I've seen it do really well. The problem is it takes about 20 minutes each time to really get the effect. Now, I've seen some work with people using wheatgrass and doing the same thing in about 5 minutes with wheatgrass. And so that's something that some of our patients have had really good luck with.
How about coconut oil and turmeric or something like that?
Yeah, using those help with the oil pulling. What's the really nasty tasting one for dental infections? I'm drawing a blank. There's a powder and an oil that just is miserable, nasty tasting, that is great to put over a dental infection. We use a lot of mud packs. We'll use like a zeal, a volcanic ash, and a bentonite clay and some fermented greens, and we'll mix that into a mud pack. And if it's a patient we can't get to right away, and they'll put that right over the infection, and they do it 3 or 4 times a day for a couple of days, and it'll just knock that infection out temporarily.
Okay. So Dr. Gerber asked, do most labs do their anti-CCL5 cytokine?
No, I don't know. It's
Do you measure that or not?
I just lectured. I don't. I just lectured. I thought it took this really high-end lab work to do that stuff, but I just lectured with Rafael Gonzalez, the stem cell guy out of LA. He's got a clinic down in Mexico that's just amazing for stem cell work, and he's had a few that the FDA's let him do here on late-stage COVID patients, COVID PET patients, that they're about 80% getting them out of the hospital with his line of stem cells. He's done a lot of work with exosomes, and he told me that there is like a really simple test, and I haven't gotten the information back from him on what it is. That was just a few days ago, where it's really simple to measure that it's like a litmus paper test or something, that it's easy to do, or a blood poke. We've got a finger poke D3 test that's not as accurate as blood work, but it's pretty close. And so that's the way we check our D3 on patients before we do surgery. And it's similar to that, is what he explained.
Dr. Stock asked, many of the CBCTs, I don't even know, not sure what that is, that I order come back with equivocal results. I've had dental thermograms that have found inflamed teeth with the patient improvement after removal. What is your experience with thermograms to identify problematic teeth, either from the root canals or fillings or improper tooth extractions?
Yes, the thermal imaging is great. I've had it done on my wife. We have a lot of patients that do it, bring their thermal imaging in. There's been some really good connections between the inflammation in the jawbone with the teeth and the inflammation in the breast. And they'll see the hot spots on the same side. We love to see the thermal imaging. We've used it a good bit. If you can find someone to read it that knows how to read it, those are Fred Hughes, I think, just retired, but the thermal imaging is great.
That was an earlier question that I missed. Who does and reads these imaging studies?
I do. There's a reader service called Beam Readers. Problem is, they're not biological dentists per se, and they're not looking specifically for cavitations. And because it's so normal to have soft spots in these wisdom tooth areas, one of my neighbors is a dental radiologist, and he doesn't think anything of them. They're just normal. Everybody has those. That's just a soft area of bone. Well, we know, we go in there, they're all full of oil and bacteria, and the patients 2 days later have this 20-year ailment. We've had like 5 patients in the last year that all their thyroid issues are gone as soon as we clean out these cavitations and take out root canal teeth. 20 years of thyroid medications over. But a lot of the traditional radiologists and don't believe that. So there's not very many of us that read them.
Okay.
Let me show you one of these real quick. We'll go to one. Hold on. So ignore the names here. Go way down here.
Not supposed to be showing us names.
Okay. So this is the case we did today. It was like 7 hours. Huge infections in these teeth. This is the kind of, but because most of your checkup x-rays at the dentist that you get taken every 6 months or a year, only are looking between the teeth. They don't show the end of the roots. And once every 3 years, it's kind of standard of care to take a Panorex x-ray. Well, the 2D Panorex x-ray many times doesn't show these areas. They're hidden because of the nature of the x-ray. So this is the skull, basically. This is kind of the cartoon version that helps patients see what we're looking at. Let me move
Is it somebody's bathroom?
thing over here so I can run my software. So this, too far. This lady was a tooth we extracted today. This great big hole in her jawbone was an infected root canal tooth. It had eaten through into the sinus. It had eaten out the side of the cortical plate, had a huge cyst. It had probably been there for years and years and just recently started giving her a few symptoms. That's normal. That's the mental frame and the mandibular nerve. This down here, you could see this hole in the bone in the wisdom tooth area is a cavitation site. Now back here, behind this back tooth, there should be bone here. And there is bone here if you look at the Panorex or a 2D x-ray, but because it's so soft, the software thinks it's not bone and it took it out for this picture. It just looks like a big hole. That was a huge cavitation site. Same thing on the other side. We get in this upper wisdom tooth area. It looks like just a big hole, like there's nothing there. Like this bone is gone. Little rim of bone is all. Lower one, same thing. Holes in the jawbone where these just rotten spots were in this cavitation. So we'll look from a different angle. We'll look from the front first. So as we look at these from the front, you can see sinuses. So we see this infection in the sinus. As I kind of scroll through that, you can see a good portion of her sinus here is full of this chronic infection because of all these infected root canal teeth. This one is this big bubble, is the abscess that had eaten away all of this, had perforated into the sinus, some big holes into the sinus from that root. Let me darken it a little bit. Make it a little easier for you to see. There we go. But unfortunately, this kind of stuff gets missed every day. The other root on that molar into the sinus. This is the breast tooth. This is the one that causes stomach and breast meridian. We go back into the cavitation site in the wisdom tooth area, and look how dark it is inside there. Down in this bottom right-hand corner are the bone density readings. And this is the important part. This is the part that many of the dental softwares, cone beam software, doesn't have the method to read these, or it's like an average of the whole area. But when I put my mouse right on that, I've got a negative 350 Hounsfield units. That's the bone density reading. You look at the cortical plate, it's 1500. You get into the medullary bone, normal, 300, 400, 200. I mean, that's normal bone. You go to negative 300, and that's going to be a massive cavitation. And so that's how I find them. And then we go in and clean them out. We'll usually look from the side is where we look. We can diagnose airway issues. We do a lot of work with sleep apnea patients. She's got a really restricted airway. That's something that we look for. Tonsil stones. We see tonsil stones all the time. We clean out all this junk in their head, hit them with a laser a couple of times, and these tonsils that were just gigantic in 3 or 4 months shrink back to where you can barely see them. I used to send all these patients to get their tonsils out. And I disagreed with my naturopaths that said they're important, they're part of the immune system. I just argued they were overwhelmed from chronic infection and they needed to come out. And I've sent a lot of adults over the years to get their tonsils out, and they felt great afterwards. But now we've learned that with ozone injections and using these lasers and getting the infections out upstream, then these tonsils will clear right up. This is a picture from the side of that big bubble into the sinus. This is that wisdom tooth area with all this dark bone is the cavitation area. We're -200 in that area. So that's kind of how I go through and look at x-rays. Here's the other big infection on that premolar. Perforated out the buccal plate, the bone's gone out there. But this side had a really big cavitation. This one's just gigantic. There's a lot of space in there, and we got so much oil out of that thing. So that's how we find them. We'll just usually diagnose as much as we can see with the cone beam, and then they fly out for surgery, and we clean all this out in one day. They stay about a week and do a post-op. I don't like them to fly for at least 4 or 5 days. And then in 5 months, usually 4 to 6 months, they'll come back and finish the implants. And so for most people, it's 2 trips to get all of this done. All right. Any more questions, comments, concerns, things I didn't go over or you'd like to ask questions about?
I was eating.
I have one big question because I've been hearing from wise guys in biologic dentistry for about 30 to 40 years. And then my biggest question is always, where can we find people with this kind of talent to send our patients?
That's a hard one.
Right now, the nearest biologic dentist is 2 hours from my office.
About 50% of my patients come from out of state. I've had them from Hawaii and Canada and Australia and Europe. And so there's not many. I mean, there's like 1,300 in our group, and not about 800 of those probably are dentists. That IOMT website, you can search on there, and dentists that are members, you can find it. However, you can get on that just by joining the organization, going to one meeting. So there's dentists who have been practicing 20 years as a biological dentist and are great, but only show up as 1 or 2 meetings. And then there's ones that are on there that have been to 3 or 4 meetings, but are still placing titanium implants. And so there's such a range of biological dentists. And I was there. When I first started doing this, Dr. Mark Lafferty, the chiropractor down here, got me into this. And I started just taking out mercury filling safely. And I was still doing mostly titanium implants. And then once I learned how bad those were, now we take them out instead of putting them in. But it took me 7 or 8 years of only doing biological dentistry before I got to the point of doing these cavitation surgeries and extraction implants in the same day. So there's not many that do that. If you can find one that's been to Dr. Voll's clinic in Switzerland with Dr. Klinghardt and Dr. Voll's, they usually do these surgeries pretty well. There's just not very many of us. But
Thank you.
to look IOMT.
You guys are still very, very rare.
We are, unfortunately. And most of my patients have been seeing a biological dentist for a long time, and they've been told 2 or 3 times that they don't have cavitations because they're using the wrong software. And then they send me the x-ray. I had a dentist from Florida told me that he was a cavitation hound, that he was one of the best biological dentists anywhere, that he knew how to find cavitations, and this lady did not have them. And he had just put a titanium implant in her as well. She was miserable, all kinds of autoimmune issues. I get her x-ray and she's got 4 of the biggest cavitations I've ever seen. She comes out for surgery, we clean them out, and they are what they look like on the x-ray. They were huge. So you just do the best you can. Try to
At least
find
you give us some hope with the laser and the ozone though, right? That's
I
something
think
that
this combination of lasers that we use, it's a Photona, it's out of Slovenia, is really the best laser on the market for dentists. I think any biological dentist that's doing these surgeries without the laser as well as the ozone, because most of them are doing the ozone, but for us, we've seen the game changer be the laser in addition. And doing the newer versions of the platelet-rich fibrin are like 20 times more effective than the first generation. And a lot of dentists are still doing the first generation or still using PRP.
Dr. Stock states he's seen cases of composite fillings that were done many years ago when it was apparent common to place a mesh between the dentine and composite fillings, that they became infected. Patients improved focal problems when addressed. Is this only his impression or others have seen this? And can a thermogram CBCT find these also?
If they've gotten to the point of being infected, then the thermogram will often show it, and the cone beam will often show it. The CBCT will show it. That is still a very valid technique that a lot of biological dentists use. It's called biomimetic dentistry. And their claim is, I've been trained in it, I just never completely bought into it. But some dentists are really good at it, or instead of doing a crown, they'll do a really big filling and put like a fiberglass mesh inside that adds some strength to the tooth. But just like any great big deep filling, they can still fail and get infected. If you've got a dentist that's doing that technique, they're usually one of the better dentists. They look funny on x-rays. They look like they have cavities around them because of the mesh leaves a space. And so you go to another dentist and he's going to tell you, oh, this has a cavity under it, and he'll drill in there and take it out. So it's kind of it's a great technique, but it does have its downsides.
Okay. Any sense of the relative positive or negative predictive values of thermogram and CBCT?
With the cone beam, we find just about everything. Now, sometimes a tooth will be mostly dead, so the meridian is almost completely turned off, but it's not died to the point where it shows infection. It's no pain, doesn't give us any reason to do that. Dr. Klinghardt and Dr. Voles have worked on this quite a bit, and have found that a lot of these old teeth that have had a lot of work done on them, big fillings, crowns, things like that, have just decreased the meridian to the point that it's barely functioning through these teeth. And so Dr. Voles actually had several of his own teeth removed and implants put in, and then showed how much it improved the function of his meridians by doing that. That's pretty extreme for us in the US to say, hey, if you got big fillings, take your teeth out and do implants. But they've got some pretty hard data showing that that could be helpful for some patients. I do muscle testing, so I test a lot of them. And everybody knows that's not an exact science, but it just is one more thing to look at that adds to what I'm seeing on the x-ray. The thermal imaging can be great for finding these hot spots that don't even show up on the x-ray.
Dr. Cruz says she's had several patients with severe tooth decay and they have their teeth pulled out due to lack of insurance or funds. Is that an option? Or is there more underlying disease that's not being addressed?
Yes, that's better than having these old infected teeth in there. So, and a lot of the old Hal Huggins was kind of the godfather of biological dentistry, and he taught that it was against even ceramic implants he didn't like. That just take the tooth out, do partial dentures or live without teeth, that's the best way. Dr. Voles and Dr. Klinghardt have shown that having a ceramic implant in the meridian activating the bone actually improves the function of the meridian, and it works better if we put something back in. And so that's kind of dispelling some of those older theories that some of these old biological dentists say, don't do any implants, even if they're porcelain. So we disagree. We think they work better with porcelain implants. I hope that answered the question there, or most of it.
And Dr. Stock asks, what software should we be looking for in our CBCT scans?
The one that I use is Romexis by Planmeca. That's what my scanner is a Planmeca. I think it's the best machine. Many of the scanners out there can be saved in a standard DICOM format. So the file extension is .dcm. DICOM is kind of the generic language of dental cone beams. However, Sirona, which is probably the biggest company, Galileos and Sirona are don't use that. They use their own proprietary, which does not import into any of the other softwares. They can save it in DICOM if they know how to do it, but none of the dentists that use it know how. And so I get about 1 in 3 that send me a Serona scan is able to get their dentist to resave it in the right format so that I can look at it. So that's one of our biggest challenges in having them sent from other people.
Okay, that's all the questions I have in the chat. Anybody else? Questions, comments? Going once, going twice. Dr. Chandler, we can't thank you enough for your time and your expertise. And this is something that I think most of the folks in our group have a little bit of knowledge about, but not a whole lot. And so we thank you for bringing it to bring it to the table here. Anything else that you have? Any comments you have? Any follow-ups?
No, I was just to say, if anybody has any questions, you're welcome to reach out to me or concerns with a patient or anything.
Can you please put your contact information up in the
put it in the chat here?
thank you.
See if that'll help. I do have a partner here, Dr. Geddes. He's a 15-year practicing dentist, converted a few years ago to biological dentistry. He's a great surgeon. He's doing all the same things I am with these surgeries. I was just getting to where it took 3 or 4 months for a patient to get in to see me, and that's always uncomfortable.
May I ask another quick question? Do you know of any relationship between the length of the incisors and relationship to Alzheimer's?
No.
Me
Never
either.
heard that. Huge relationship with Mercury.
I'm sorry, that was,
I said there's a huge relationship with mercury fillings.
yes.
We've known that for a long time.
Okay.
Here's the website, and then you can
Give it to John, right?
see whatever else I can get in there. Trying to go down, but phone number. Oh, and an email. I'll give you that too. Okay.
There we go. All right, we got a lot of kudos for you here from the gallery, Dr. Chandler. So
Thanks,
Thank
guys.
thank
Great
you
talking to
all
you.
so much. Again, his information is right here, and again, we can't thank you enough for spending some time with us. Hopefully we'll in the future get to see you again. Don't be a stranger, and if you have anything else to share with us, please let us know. As far as next week, we have Yusuf Erskine, who has a program for physician burnout, and he's running actually a 3-session, 2 online, 1 in person, 15 CME credit AOA hour workshop on physician burnout, and he's going to give us an insight on that next week. Again, our program, March 25th to 27th in Las Vegas at the Flamingo Hotel. The room rate changes on March 3rd. We have a really, it's if you've been to a hotel lately, we have a great room rate. We can get Thursday, Friday, and Saturday for less than $350, and that's on the Strip. You can't beat that. There's some taxes in there too. We have, again, an all-star lineup. Dr. Chandler mentioned we have Dr. Tom Levy will be with us. And you know, some of the folks that are here, of course, will be with us. We're looking to, again, to do another breakout room. So those of you who I haven't gotten to yet, just hang tight. And we're going to try and get everybody in who's wanted to contribute. If again, go to aosrd.org/event, click that. That'll take us to the your new website, and you can register there. Please send the flyers, our flyers, to anybody you know, your whole mailing list, because we want to have a big we want to have a big turnout. Again, we have some very special guests. In addition to Dr. McCullough, we have Dr. Jacob Teitelbaum. Those of you who've had any kind of interest in chronic fatigue syndrome know that name. Anybody who's been to any of the A4M lectures knows Felice Gersh and Kathleen O'Neill Smith. Of course, Dr. Halasso will be bringing us his latest on COVID. And Dr. Spear, also our patriarch, will be giving us a rheumatology lecture. And we also have Brittany Partain from Avis, which is a specialized rheumatology laboratory, which will be explaining all very intricate tests on autoimmunity and all sorts of rheumatological disorders. We also have, out here in the West, we have the state's mandate 2 hours of pain management, opioid management. Dr. Leskovitz will be doing that again for us. We have 2 hours actually of medical ethics. Dr. Cruz and Dr. Stock, and then Dr. Burgess and Joel Peterson will be doing our suicide. So those are all the state mandated lectures. So you come to us and you don't have to worry about it for the rest of the year. We're in California 2 years. We have a great lineup, and as you know, we always have some pretty nice entertainment afterwards. We're really looking forward to getting together. I hope we understand if you're concerned about meeting in person, and we will have an online presence. We also really would like you to be live with us if you can. From time to time, we're sending out some discounts on the tuition, so be on the lookout for those. And we have some very great sponsors, that the vendors that are coming, and I'm sure David, who just joined us, is going to be there with us also, right, David?
Yeah, you got me.
Okay.
I hate to fly. That's my challenge, but I'll overcome it.
Okay. All right. Well, we look forward to it. Dr. Chandler, again, thank you so much. And if you can make it to Las Vegas at the end of March, we'd love to have you too.
I'll look
Okay.
at it.
And
Yeah.
I'm trying.
We all hate to fly right now, David.
Yeah, and I've been trying to twist Nacarato's arm, but I don't think I'm getting too far with him either.
Yeah.
So again, next week, Yusuf Erskine will be talking about physician burnout and his program. Dr. Chandler, we can't thank you so much for being with us.
Thanks, guys. Good to meet you.
If it's okay with you, we've recorded this session and we have it on our website, aosrd.org/webinars. We have the event is for the conference. There's that, and aosrd.org/webinars is all of the
PSA down under if I have blood.
it's .org, not jerk there, sorry. Okay, let me do it again. It's aosrd.org/webinars. All right, I got it right that time. We have all of our webinars, and apparently we're starting to get a little following. I've gotten a few phone calls from lay people even who said they've been watching our back lectures. So they're not in vain. Like I said, Dr. Chandler, we've been doing these for 1.5 years. You're our first dental consultant, but hopefully that you won't be the last.
Dr. Clearfield, quick question. For the Las Vegas seminar, if I sign up for to do it online and then later on I can go in person, can I
Yes.
just upgrade it? Is
Yes,
that possible?
yes,
Okay.
absolutely.
Thanks.
Okay, absolutely. We insist.
Thank you.
All right. Okay, anybody else have any other questions or comments? If not, Dr. Chandler, thank you again so much. We will have the video of this up probably within 24 to 48 hours. And we'll see you again next time, next week, same time, same station. And everybody keep doing the good stuff, okay? And we will see you again.